Okay, FAQs. What's the difference between an HMO and a PPO? So if you're comparing health insurance plans or Medicare Advantage plans, this is going to come up. A lot of plans will have, a lot of plans will offer you an HMO version or a PPO version. It has to do with the network, and more specifically, it has to do with can you get care outside of the network? Okay, so providers have networks because they've negotiated a pricing structure for services. Okay, that's the whole point of the network. That's why when you have a Medicare Advantage plan, you have to stay within the network for better pricing. An HMO plan essentially says there is no way to get service outside of our network. The only exception to that is going to typically be life and death emergency type situations. Otherwise, you are required to stay within the network. Now, some HMO plans also will go a little further in that they require you to list a primary care doctor. And many times that doctor becomes kind of the gatekeeper to refer you into other services. Not always. Sometimes that happens. But you're certainly not going to get any benefits outside of the network on an HMO. Now, on a PPO, there are out-of-network benefits. So what you have to understand, however, is if you choose to go to a provider that's outside of the plan's network, they will still help pay for it, but you're going to pay a little bit more. So if there's a copay for seeing a doctor, often it's going to be higher, maybe even double if you go to a doctor that's outside of that plan's network. But unlike an HMO, if you have a PPO, you will at least get some help, some access to those providers. Now, when you're talking about Medicare Advantage plans, a lot of times the HMO plans are going to offer a little bit better benefits for the same money because of that cost containment structure they've built in. But now you know the difference.